Erectile dysfunction is a part of life for many men, but it doesn't have to stay that way. New technologies allowing couples to reinvigorate their sex lives, and ED expert Bill Jeffries is here with the details. He joins me once again. Nice to have you here again.
Thanks, Alex. Good to be here.
Always great to see you, because what you're doing is transforming people's lives. And we're talking about the therapy that does it. It's called acoustic wave therapy. We've talked about it. But first, let's talk about the problem of ED itself. How serious is it? How widespread?
Very widespread. The fact is that most men are going to experience ED in their lives. Statistics show about 75% of men, by the time they hit 70 years of age, will be having ED issues. The good news is that we have a fix for it. The sad statistic is only about 30% of men that have ED symptoms will seek treatment for it.
Which is tragic if you think about it, because they have to live maybe the rest of their lives that way. It doesn't just resolve itself naturally and automatically, but the science behind this is really what makes it so special, because it doesn't involve needles, it doesn't involve pills. Talk about acoustic wave therapy for those who don't know what it is.
Sure. Well, we first have to understand that ED is really just a plumbing issue. It's lack of adequate blood flow, and the way the pharmaceutical remedies work is they dilate those blood vessels to carry more blood. Our approach is, using acoustic wave therapy, is to break up that plaque and restore blood flow naturally, the way nature intended, basically.
And guys that have, say, other conditions like, say, diabetes, is this safe for them as well?
Absolutely. Resounding yes. It's safe for virtually everybody. Because there's no drug interactions to be concerned about, most guys, it's just the perfect treatment for them, because we don't have to interrupt other things that they're doing for other health issues that they're battling.
Yeah, and you can fit it into your life, right? Because it does take a series of treatments, not just one.
That's correct, yes. And because it is a series of treatment, one of the questions I get asked a lot is, what happens to that plaque once we break it up? And because it is a series of treatments, the plaque buildup, we break it up gradually, microscopically, and the body filters it out just like any other toxin or waste that's in the body.
Right. Now, when we say series, what's a standard series that you see?
Anywhere from a couple of weeks to a couple of months of therapy for most guys. It depends on the severity of their ED. We're seeing younger and younger guys coming into the clinic, even in their 40s, starting to have some ED symptoms. The younger the guy is, typically the faster we can resolve it. It just is kind of geared towards each patient.
Right, and I mean, you're talking a matter of weeks you have this resolved, so I guess it would be suitable, say, for the snowbirds that are here in town.
Absolutely. If you're in town for a little bit here to enjoy this beautiful weather and having some ED issues, give us a call. We'll get it resolved before you head home.
Yeah, and then you can enjoy that beautiful weather with a big smile on your face,
Absolutely.
Right? So, of course, when we're talking about Flagstone Medical, as somebody under the care of an actual physician, people might wonder. Okay.
Yes, our medical director is a board-certified physician, an expert in ED. All we do at Flagstone Medical is deal with erectile dysfunction issues. That's what we focus on all day, every day. The technicians that actually do the treatments are skilled medical people, EMT, paramedic backgrounds, years and years of experience with medical things, and that's what we do. We're specialists.
Right, and we've discussed this countless times, and the truth is it's not something that someone should be ashamed of, right? It's sort of like, say you have a broken arm, what do? You go to the doctor. Say you get sick, what do? You go to the doctor. So the fact is, it's something that you have to discuss, not only with yourself, but of course your partner, and someone who cares there at Flagstone Medical. This has to be really rewarding for you in a lot of ways. What would you say is your favorite part of doing this job?
My favorite part of the job is when couples come in together for that initial consultation, and I get to talk to them about some of the history and things that they've been through, and then I get to check up on them as they're going through the therapy, and when I see the smiles on their faces and they talk about what this has done to kind of bring their relationship and rekindle their relationship. Very rewarding and very, very fun part of my job.
Absolutely. I would say, I mean, the loss of that intimacy can have such a deep negative, impact on your relationship. The truth is that being intimate and being close is something that, like you say, brings us together. So when that gets taken away from you, it can certainly take its toll more than you know, can be a subconscious sort of a stressor. So taking care of it with this really will make the difference. So Bill Jeffries, thanks for being here. You guys are offering some great specials too that I'll tell them about. Nice to see you.
Thanks, Alex.
Of course. And you can get a free physical exam and consultation if you mention the Morning Blend. That's a $199 value. And also, if you purchase a treatment during January, you'll get a free supplement program to enhance the blood flow even more. That's a $75 value. And if you want more information, visit flagstonemedical.com or call 520-600-4405.